If you or someone you know are a survivor of sexual violence, I will be helping you understand the situation and learn different methods of building resilience outside of the therapy room. Sexual violence is a sexual act that is committed or attempted by another person without freely giving consent against someone who is unable to consent or refuse. For college students, it's important to understand that you cannot fully consent if you are under the influence of drugs or alcohol. This might look like being forced or coerced to engage in unwanted sexual contact, including unwanted kissing, fondling, grabbing, or penetration. Sexual violence also includes sexual experiences without physical contact, such as verbal sexual harassment. Although sexual violence can happen anywhere, college campus sexual violence is a pervasive risk. Male-identifying college students are 78% more likely than non-students to experience sexual violence, whereas female-identifying college students are less likely than non-students. All adults face a risk, however, that risk increases when you are on a college campus. This is seen in the way that 13% of students on college campuses experience sexual violence. Female college students are disproportionately affected at higher rates. This does not mean that male college students experience no sexual violence at all. Marginalized communities, especially people of color or LGBTQ+ individuals, face a higher risk of experiencing sexual violence, where bisexual people of color face the highest risk. In 80% of cases, the perpetrator is someone the survivor knows. Many students who experience sexual violence do not report the situation to professionals. Reasons for not reporting include beliefs that it is a personal matter, not important enough to report, or fear of retaliation from the perpetrator. Only 4% of students report, even if it is not to the police. Due to these reasons, students who experience sexual violence may face symptoms of PTSD, depression, anxiety, or suicidality. Lifetime prevalence of PTSD for female survivors of sexual violence is estimated to be as high as 50%, exhibited most notably through flashbacks, emotional detachment, avoidance, and hypervigilance. One study reported that 94% of women experience PTSD symptoms during the first 2 weeks after an assault, and PTSD can manifest within a month. College students who experience sexual violence may also develop a dependency on alcohol to cope with the traumatic experience. Now, you're probably wondering what this might actually look like. In college students who have experienced sexual violence, you or someone you know may experience persistent sadness, fatigue, or changes in sleep or eating habits, withdrawing from social life or academics, such as declining grades or class attendance, sudden weight loss or weight gain, new or increased substance use, avoiding certain people, places, or situations, unexplained STIs or STDs, or disclosure of self-harm or suicidal thoughts. Now that we know what to look for, let's understand what's actually going on. If you've ever heard the saying, the body stores trauma, but don't understand what it means, I'll be breaking down some brain-body connections to explain this. It's important to note that a multitude of factors can influence the actual impact of a traumatic event, including one's environment and social factors, as well as psychological and biological effects. During and after a potentially traumatic event, such as sexual violence, the HPA axis is activated, which includes your hypothalamus, pituitary gland, and adrenal glands. Its main responsibility is to regulate your body's way of telling you fight, flight, or freeze. Your amygdala is known as the brain's emotion center. It is responsible for processing and organizing emotional memories. It also affects the hippocampus, which is responsible for grouping information into your memory. Chronic overactivation of the stress response leads to dysregulation or structural changes of these brain regions and shows an increased risk for depression, chronic stress, PTSD, low self-esteem, and anxiety. Now, just in the way your body stores trauma, it can also learn to grow through resilience. Trauma and resilience are not mutually exclusive. Sexual violence survivors can and often do experience distress and healing simultaneously. This means that you can experience trauma and still grow in spite of it. A study done by Reed and colleagues broadly defined resilience as a dynamic, nonlinear, socio-emotional process of adapting to adverse events occurring continuously after sexual violence victimization. It refers to the capacity to cope, adapt to, and construct one's life after sexual violence in ways that are culturally relevant and guided by the survivor's own preferences and desired outcomes. Overall, resilience is a living, breathing, moving concept that can shift in how it manifests over time and looks different for each survivor. Now, these brain structures are actually all implicated in building resilience as well. In resilient individuals, the prefrontal cortex supports executive decision making, helping to regulate emotional reactivity in the amygdala. This prevents chronic hyperarousal of initiating the fear response. The hippocampus aids the extinction of fear memories, and the interconnectivity of all of these regions regulates the HPA axis. Resilient individuals exhibit stronger connectivity between these areas, enabling efficient control over emotional stability, adaptive coping mechanisms, and greater plasticity of this circuit by regulating the overproduction of cortisol. Additionally, neuroplasticity is the brain's capacity to form new neural connections, serving as the foundation of resilience and allowing survivors to reframe experiences and restore balance after trauma. Now let's talk about helping you or someone you know build resilience after sexual violence. It is strongly encouraged to seek professional help as soon as possible. Therapy options include trauma-focused CBT. TFCBT focuses on changing thought patterns and cognitions, decreasing negative emotions, developing skills to cope with negative thoughts, anxiety, and trauma symptoms, and restoring effective social skills. EMDR is also largely popular for targeting traumatic memories. In EMDR, it changes the processing of traumatic memories through dual attention. Clients in EMDR think of a past or present memory while focusing on a visual stimulus. Ultimately, this decreases anxiety when thinking of the traumatic memory. However, there are a variety of barriers to accessing these treatments, especially considering the unique nature of college. Although sexual assault programs are becoming more pervasive across college campuses, these programs are not always effective in implementing long-term changes. To add, one size does not fit all. Different people need different treatments. There is no cookie-cutter treatment for every survivor, as symptoms and severity can manifest in many ways. University counseling centers offer crisis response immediately following an assault and services during investigations if students report. However, half of college sexual violence survivors find themselves stuck with brief 3 to 6 session limits before being referred off campus to treatment, where they face long wait times to continue care or high costs of treatment. Therefore, it's becoming increasingly necessary to provide scalable treatments to address these gaps. These therapist-free interventions involve self-help. Those who have recovered report that it is helpful to access multiple recovery strategies and resources to fully integrate diverse aspects of the traumatic event and effectively cope. If you are currently receiving treatment or waiting to see a provider, these following techniques are some ways that you can build resilience outside of therapy. No matter what kind of treatment you seek, these interventions are meant to be used in conjunction with therapy, not completely replace them. Trauma-focused yoga is a mind and body practice with origins in ancient Indian philosophy, combining physical poses, breathing techniques, and meditation or relaxation. Yoga includes a focus on physical movement, reducing negative symptoms of trauma, depression, and anxiety due to a combination of physical postures, breathwork, and meditation. Additionally, yoga breathwork is beneficial in building control and awareness over physical and mental states. It helps survivors reconnect the mind with the body in a safe way and produces a sense of agency. It increases a sense of control over themselves, contrasted to the loss of control they previously felt following sexual violence. It also helps promote neuroplasticity by increasing hormones responsible for regulating the HPA axis and increasing volume in the prefrontal cortex and hippocampus. Yoga is cost-effective and increasingly accessible. You can sign up for group classes or access online videos on YouTube. You can also engage in emotional freedom techniques. This is a technique from traditional Chinese medicine that utilizes established techniques within clinical practice, but it adds the novel component of stimulating acupoints while memories are activated and reframed with phrases of self-acceptance. This following video demonstrates the tapping techniques used in EFT.
Have you ever noticed how talking about it doesn't always make it feel better? That's because trauma and stress aren't just stored in the mind, they live in the body. So even if you understand why you feel the way you do, your nervous system might be still stuck in survival mode. And that's where EFT comes in. Tapping uses both words and body-based input. You're stimulating specific acupressure points while staying connected to what you're feeling. It's like saying to your body, yes, this is hard, and I'm safe now. And the science backs it. Tapping sends calming signals to the brain, lowers cortisol, and helps deactivate the stress response. And that's why EFT works, even when talking alone doesn't. It helps your system to complete what it never got to finish. And in that, there's real healing.
EFT has been shown to simultaneously reduce symptoms of depression, anxiety, and PTSD that survivors of sexual violence may face and bolster resilience. This promotes neuroplasticity because it targets HPA axis dysfunction, rebalancing cortisol levels, and fosters growth in the hippocampus as well. A benefit attributed to EFT is its ability to be used outside of clinical settings as a safe and reliable self-help method for reducing stress. Again, it is important to emphasize that these cannot replace therapy as a standalone treatment. Lastly, a recurring theme throughout research is the importance of social support for survivors of sexual violence, especially on college campuses. Social support is an experience provided by others with emotional resources or instrumental resources that helps people cope with stress. The presence of social support and not feeling lonely were consistently the significant predictors of resilience and well-being after sexual violence. On this note, I stress that community care is preventative care. Resilience does not occur in isolation and is dependent upon context or environment, including our relationships. On college campuses, this may look like multicultural centers or groups such as social interest clubs that are not part of Greek life. Perceived positive regard and support has also been shown to be important to recovery. College students' sense of belonging on campus can be defined as their perceived social support on campus, feelings of connectedness with community members, and the experience of feeling accepted and respected to the campus community. The real help is to offer a meaningful relationship to survivors where they can feel valuable and authentic. In conclusion, resilience is not about completely getting rid of your trauma. You learn to grow from it, bounce back, and become stronger in the face of adversity. Building resilience is taking an active stance against struggle. Some additional resources listed on this slide is the book The Body Keeps the Score and college campus resources. At Santa Clara University, our Wellness Center has several resources on their website as well as a confidential survivor advocate. You can always call, text, or chat with Brain's hotline. You do not have to recover alone. Help is out there and you can learn how to trust others and yourself again. Thank you so much for your time and listening.